Today, we are honored to be joined by Dr. Gilbert, a distinguished Norwegian physician and humanitarian. Over the years, Dr. Gilbert has been a vital voice and presence witnessing and documenting the human impact on the ongoing crisis in Gaza. He volunteered to work in the Gaza Strip for a period of more than 15 years. In the face of immense challenges, he continues to advocate for the lives and the dignity of those affected. Hello, Professor, and thank you so much for being with us today.
Assalamu alaikum, Aman, and thank you so much for having me.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Doctor, I just want to dive right in. Thank you for once again giving me your time. I want to ask you about the healthcare system in Gaza. Can you give us an insider look?
Well, what people do not know is that the healthcare system in Gaza was at a very high level before the attack started on the 7th of October. Palestine, in general, both in the West Bank and in Gaza, is a very well-developed society. It's not like a third world country. And the healthcare system in Gaza, despite 16, 17 years of brutal Israeli siege, was developed to a very high level. They had 36 hospitals. They had more than 50 primary healthcare centers. They had 10 universities. They had medical schools, both in the Islamic University and in the Al-Azhar University. They educate doctors, nurses, all types of medical specialists. All of this thanks to the intense efforts of the Palestinian people in Gaza. And I've been working in this healthcare system for many years, as you mentioned. Actually, my first mission to work with the Palestinian healthcare system was to Beirut in 1982 during the Israeli invasion of Lebanon and the siege of Beirut. And I saw that even in diaspora, they were clever to organize and to educate their people. And for the last 15, 20 years, I have been engaged as a visiting professor to Al-Azhar University. I've been working in Shifa Hospital, in Al-Aqsa Hospital, during many of the attacks from the Israeli occupation forces. And I've been doing research together with my Palestinian colleagues. So this was a medical system at high level, comparable to European medical systems. They produced research, they produced good healthcare for the 2.2 million people in Gaza. That said, of course, they had lots of problems because of the siege and the strangulation of Gaza, with poverty, with unemployment, with all these factors that are important for public health. But when it came to handling diseases, when it came to handling the trauma of the attacks, the Palestinian healthcare system was a good system. Now, they have completely ruined it. As you know, they have bombed all the universities in Gaza. And I just did a little math here on the numbers based on the last United Nations report from the 20th actually of October. And now it's only 1 out of 3 hospitals that are operative. And these 1 out of 3 hospitals, 14 hospitals out of 36, they are operative at a much, much lower level than what is needed, because the Israeli occupation army has always had the tradition, unfortunately, of attacking healthcare. 2 weeks ago, a new special report was released to the United Nations on the attacks on healthcare. And they documented that since the 7th of October, 2023, the Israeli occupation army has perpetrated 1,018 attacks. 1,018 attacks on healthcare in Gaza and the West Bank. And until now, they have killed more than 1,000 of my colleagues, my healthcare workers' colleagues in Gaza and the West Bank, doctors, nurses, ambulance paramedics, X-ray experts, and so on. So what we have today is a brutal destruction of healthcare in Gaza, man-made 100%. It is deliberate. It's not by chance. It is documented, well documented, that Israeli tactique is to attack the Palestinian healthcare system, both the hospitals, the ambulances, and the primary healthcare clinics, and not at least the maternity health care for the pregnant and lactating women, to actually destroy the Palestinian society. And we all have to stand up against that, because it is a war crime, and because, of course, it is a horrible crime against the Palestinian people, our brothers and sisters in Gaza and in the West Bank.
You're absolutely correct. This well-documented, brutal destruction that we are witnessing is absolutely devastating. And since aid is literally trickling into Gaza, I want to ask you, do you have any messages that right now, everyone that's tuned in, whether they're in their car, their homes, or perhaps over social media, any messages to motivate people to donate, to be part of this campaign, and to help our brothers and sisters, especially coming towards the winter season?
I want to say to everyone who's listening in Jordan, and I know the great heart of the Jordanian people. I know the great heart of all of you Jordanian people who have Palestinian roots. I know the close relationship between Jordan, the Jordanian people, and the Palestinian people, and your great solidarity. I know that Jordan was the first country and the only country who dared challenge the Israeli occupation forces and airdropped medical supplies with your cargo planes into Gaza last year, very bravely, and that you have been sending lots of support. Dr. Fauci, I know him well. I know many of my colleagues in Jordan who have been really working night and day to support the Palestinian people through the healthcare. My message to anyone listening now is, every one of us must do more. Every one of us must understand that we are at a critical crossroad in history, in human history. Because if Israel gets away with these merciless attacks on healthcare, and don't forget that healthcare, ambulances, and healthcare personnel are protected by the Geneva Convention and by international law. You're not allowed to attack them. If this is allowed to continue, we are all in great danger. Who will be the next? Will it be Jordan? Will it be Syria? Will it be, as we see now, Lebanon? So every one of you who listen, you must stand up, you must do more, you must donate to this campaign to support Palestinian healthcare and hospitals in Gaza, and you must also do whatever you can to influence your politicians and your neighbors and your neighborhood and your grocery store to join into the boycott and divestment campaign, and to be an activist, because we have to stand tall now. What you do now is what you would have done during Holocaust. And what you do not do now is what you did not do during Holocaust. This is not only an attack on the Palestinian people. This is an attack on all humanity. This is an attack on the security of every woman, every child, every man all over the world. Because if the United States and Israel will get away with this brutal, insane attack on Palestinian healthcare, they can do it anywhere. And right now, as we are speaking, they're bombing Kamal Adwan Hospital, Mustashfa Kamal Adwan, which have been besieged, and where they killed the son of Dr. Hussam, the medical director. Today, they have bombed the upper floors of Kamal Adwan Hospital, where all the medical stores were. They have bombed the oxygen machine. They have bombed the water desalination plant. They do everything, the Israeli occupation forces, to destroy life in Gaza. We have to be on the side of life. We have to be on the side of anti-colonial struggle. We have to stand tall, and I urge you all, donate and be an activist.
Thank you once again for these words, and I really do hope you've influenced all of our dear listeners. Thank you so much for giving us your time, and as you say, be on the side of life. Stand tall, stand up, and donate today and tomorrow. And if you can't donate with your dollar, you can't donate with your JD, go ahead, donate with your voice. I'm going to tell you in just a little bit how you can donate, but for now, Dr. Gilbert, it has been a pleasure. Thank you so much for being with us today.